Great. Thank you all today for joining us. My name is Alex McFedrin. As you know, I work for UNICEF in the polio department, and I sit at WHO. I'm here today joined with Irma Mononcourt, senior UNICEF consultant and former rep and DEP rep with UNICEF, who has lots of experience to share with us. Today's topic is C4D, Communication for Development, Monitoring and Evaluation in Polio Outbreaks. And our objective is to provide an overview of monitoring and evaluation that can also be applied to other disease outbreaks, with particular attention to C4D implementation and community engagement. We will start right away, so please just make sure you have your computers on mute. It helps with sound clarity, and I think everyone does at this point. If you have any issues with the recording or logging in, you can write in the messaging on the bottom left of your screen, and I'll try to answer that through the webinar support. And if you have any questions about the presentation, please jot them down, and after the presentation we will take questions and answers. And any other participation we will ask for during the presentation, Irma will provide instructions. So we have a few participatory sections in this webinar, so hopefully you can provide some quick answers, and then we'll move along in that way. So thank you again for all joining us, and we'll just go over the contents. Irma, I'll pass it over to you, and you can finish your introduction and do the contents. Thank you.
Thank you, Alex. Greetings, everyone. This presentation is around, as you can see, 6 major points. What I'd like to do in the beginning is just to link the whole idea of C4D monitoring to program design and where it fits in the overall program planning cycle that UNICEF uses. I'd like to spend some time talking with you about 2 types or 2 ways of monitoring C4D. Finally, there's an exercise that we'll have initially. I'll talk again about the challenges of C4D monitoring, and in addition to that, discuss the concept of independent monitoring, because when we talk about C4D in a polio situation, there are 3 types of actual monitoring going on, and I want to provide clarity between them. And finally, an opportunity for you to make observations on your experiences working in polio and trying to monitor it, as well as any questions and answers. So we'll start. What I've tried to present here is just an overall view. If you think on the left-hand side of this particular chart, you see the program planning cycle where UNICEF is generally, whether it's a polio program or any other program, it's trying to articulate its strategic result areas, the program objectives, the behavioral and C4D objectives, and the strategies. And on the right-hand side, to just remind you of the kinds of monitoring and evaluation approaches that are used in the whole field of C4D. So we will be focusing our discussion today really at the behavioral and C4D objectives level, and looking more specifically at behavioral monitoring and talking about implementation monitoring, which, as you see, is linked to the strategies, the interventions, and the activities. So we're focusing on the second half of this particular chart. What I've tried to present here primarily is simply, if we were looking at a program, and all of you have had experience doing programming, so you would be aware of course, having your overall objective and then trying to put in this case, the program would be the end of polio. We're looking at trying to reduce missed children, and from the C4D angle, that part that's unique to C4D is looking at the knowledge, the attitude, and practices component, and that's, as you see in blue, those are the areas where we'll be talking about behavioral monitoring. And of course, to make those happen, we have in mind a number of different activities, a number of different inputs that we think are relevant that get us, as the arrow shows, to achieving those particular objectives. And so you see the relationship of implementation monitoring. Okay, take a few minutes, look at this particular slide, and just tell me on the instant messenger, what do you see? This is a polio vaccination campaign going on. And assume that you're the person out in the field monitoring. Just write down very quickly, what are the things you see?
We have a couple of suggestions here from Mac. He says under 5 kids for vaccination. From Savita, she says target group children with many other needs. Glenn has asked, where is the vaccine? Narcisse has said, no caregivers, only children in the scene.
Okay, we'll come back to this.
And 2 more. Sorry, Irma. It looks like an IDP situation, looking at their shelter and possibly with other integrated health care needs, or like a displaced population is another example, and that they have other priority concerns. And you have 2 more people who have something.
Okay.
So let's just take the last 2 and then pass it back to Irma. Again, another suggesting it looks like an IDP camp. Malnourished children with nourished child with siblings. Okay, so we're going to pass it back to Irma and keep those thoughts in mind throughout the presentation.
Okay, we'll come back to this particular slide again because I'll be asking you a further question based on your observations of what you've seen. But let's go ahead for a moment and talk about implementation monitoring. Some of you call this process monitoring, but in any case, as you can see, the emphasis is really on the inputs and the activities that may be going on in a polio vaccination campaign. We'll talk about the planning itself, how that's happening, if micro-planning is occurring or not, the time frame these activities are taking place. For the work that's done in messaging, we're looking at issues, as you know, in terms of outreach, acceptance, frequency, the quality of the message itself. Does it do what it was designed to do? Is it appropriate? Is it culturally appropriate for the populations? We're looking at the different C4D approaches. Are we involved here in community engagement? Are we trying to do social mobilization? Are we trying to do advocacy? Are we trying to do just a variety of different things that can occur within a C4D program? And ultimately, as I said earlier, the activities. I would like to highlight that one of the common traps that we seem to see is that many people, when measuring this, assume or think that they're actually measuring the behavioral part of the program. And so I've put this kind of don't get caught in the common trap because, yes, this will tell us about implementation, the quality, the extent to which we're doing at the timing that we had in mind, but it does not help us answer the question of effectiveness. So it has that limitation, but what it does allow us to do are 3 key things. One is to make some decision about the objectives, the activities. Are they linking appropriately to the behaviors around the inputs? It helps us document and justify the resources that are being spent. And of course, when combined with behavioral monitoring, enables us to make a compelling case for continued or additional funding, and in many cases, mid-course corrections. So we definitely need to do implementation monitoring. It's just being very clear what that focus is compared to other things that we need to be doing. This is the area that most of us do without blinking. It's the easiest thing that we do. It's the first thing that we do. The position of this presentation is we have to do more than that now. So let's talk about behavioral monitoring. As you know, we're tracking at this particular point. Our intent is to track on the behaviors, to track on the knowledge areas, to track on the attitudes, to track on the skills that may be needed to really achieve the behavioral outcomes. So we will start from the point of view of having C4D objectives and results that are written in a SMART manner. That means they're measurable, they're realistic, they're time-bound. So all those criteria are there, and we need to track on it. This we have to do continually throughout the implementation process. Oftentimes people wait and almost get involved in evaluating the behavior change rather than doing the actual tracking on what is considered to be the priority, knowledge, attitude, skill, and other behavioral determinants. And so the focus of behavioral monitoring is to really zero in on those things that we think from a behavioral point of view will get us to achieve the particular objectives. And it's at this point that we can talk about effectiveness rather than the quality, rather than the implementation. Is our implementation, even if it's of good quality, the question now before us is it effective? So, when we're thinking about doing this tracking and monitoring, what are we really saying? Is one, we have to be very clear which behaviors that we want to track. It doesn't mean we do all of them, but it's trying to be very clear on what are the priority behaviors that we're looking for and what are their behavioral determinants that we want to follow up on. So if we're using our KAP paradigm, we're trying to get very clear what is the K, what is the A, and what is the P that we're going to track and monitor over time. And of course, we've got to figure out within a campaign how frequent we're going to collect this particular data. Clearly, there's the issue of monitoring methods. Probably one of the most common is observation. However, one could have a survey or a checklist or something of that kind, but you still would want to have a structured method of you still would want to have a structured way of collecting the data that everyone's using. The assumption with behavioral monitoring is that it is program staff, C4D staff, that's actually collecting this data. Its power is in the fact that we will want to graph it and follow it and look at it for patterns and trends over time. So it's not a one-off. It is continuous, but it loses its value if it is not graphed and it's not analyzed. So one of the things we see often is in programs is that people do have data, but nobody really looked at it from an analytical point of view to see if there are patterns or changes or trends before they get to the evaluation. Like implementation monitoring, one of the key things we want to do is to look at the results so we can have those discussions. We can look at things that can be undertaken to either reinforce or maintain behaviors that we see are manifesting themselves. As I mentioned earlier, the how, there's direct observations. There's the actual supervisory visits that may occur. There's self-monitoring, and some of you may be familiar with U-Report and other new technologies that are being used where people capture information, photoshops of with smartphones of things that they're observing in the field to begin to go back and look again at the patterns and trends. Do you see the same behaviors manifesting themselves over time, or are you seeing different behaviors given the different visits? We also look at secondary review, so we'll want to look at the reports that other members on the polio teams may have observations they have made. And of course, we still will have the room for research, anthropological research, other rapid assessments. That still goes on during this period as well. So I bring you back to the photo. You've already listed for us the different things that you saw. So my question to you now is, what type of monitoring would this photo be appropriate for? Implementation monitoring or behavioral monitoring? Write your answers down, please.
We have a couple coming in now, but before, I have one that says both, a couple that say both, one that says implementation, another that says both, many more that say both.
Okay, good enough. That's correct. Primarily, however, this particular slide was one that was taken to use for behavioral monitoring. And it did the number of things that a number of you identified. It looked at the fact that there were under 5 children in the household. It looked at the fact that there were other kind of issues that are going on. And it looks like the mother is in the child's hair. If you look closely, Some people says perhaps she's trying to take away hair lice. It's not clear what it is. But I think Glenn raised the point, it could be if you were looking for the vaccine, and then you would be talking about, of course, the implementation monitoring. But the idea here is looking for the under 5 children, and what one would expect if you were truly using it for behavioral monitoring is what? You try to look at the finger to see if the marking was there. But what are the key challenges? I think there's 3 things I'd just like to call to mind, especially when we're talking about behavioral monitoring. And one is one I call the fallacy of the silver bullet, that this is going to fix it all. And I think what's really, really critical that we have to consider, as I said earlier, is what elements of the activities or the behavioral that we consider to be absolutely essential. If we're talking about tracking and monitoring on the behavioral side and on the implementation side, we don't want to do everything. So it means having that time discussing with colleagues and prioritizing what are the key elements that from evidence, from past experience, from the research tells us that these are the keys, these are the triggers that might make the greatest contribution to change. Given that we work in the real world, we must always have space for plausible alternatives to explain what we find. And I think our tendency sometimes, especially when we're looking at the behavioral monitoring, is to constantly look at cause and effect as if all the things we did was the only reason something happened. If you believe in the concept of plausible alternatives, it means not only must you understand your work and what you've been doing, your activities, and what you're trying to attain in terms of behavioral results, but you must also have a sense of what other people are doing around the same area, the same topic, during the same time period. Because what we find may be influenced by our efforts, for sure, but it could also be influenced by other things that are going on. So it gets us into the discussion of what is attribution and how much of it can we say was actually due to our work and our work alone. Our view is always think about plausible alternatives, always be available, have the potential to talk about what else, what could have happened. And lastly, I think something that we're all familiar with, there are other factors in which we do our C4D programming for polio that we have no control over. The political environment, the climatic environment, other things that may affect, again, what we may find, but we're not controlling it. So we're looking at behavioral monitoring to help us track on the knowledge, attitude, practices, and skill components of behaviors that are of interest to us. So if we're talking about reducing the number of missed children, we want to look at all aspects that are most important to that. But again, there may be other things happening that we're not controlling. So there's work we can do on the C4D monitoring side of this, both implementation and from the behavioral side. But I think in polio, unlike other program sectors, there is another type of monitoring that goes on during a polio campaign, and that's independent monitoring. And I think the key thing that you should keep in mind, which I've highlighted in red, is this is an objective, independent source of monitoring. So it would not be the project staff that would do this. These are outsiders brought in to look at each campaign and what's happening, and they have 3 main goals. One is to try to identify why there are reasons for missed children. 2, to identify any problems with the implementation with the aim of providing advice and guidance on corrective measures to be taken. And at the same time, the third area would be looking at data quality problems. To look at, is the information consistent that may be coming out of the monitoring compared to some other data collection, administrative data that may be collected. They are responsible for trying to get those discrepancies. So if you think about a polio campaign in the timeline, and you are putting it within the context of independent monitoring, there are 3 phases to think about this. There's the pre-campaign phase, where the focus is on campaign preparedness. And as I said earlier, these would be individuals who have been identified from the outside, and they would be looking at such things as, are the district meetings being held? Is the micro planning being undertaken? How, when, where, who's involved? To what extent are people really doing it in a quality manner? These will also be looking at the type of training that has gone on for those who will be involved in the campaign. Is it of the quality? Did it have sufficient content? And finally, it would look at the government's involvement. To what extent is the government taking a leadership role? In what context? Under what circumstances? All of that is that monitoring that independent monitors would do at the campaign preparedness function. In other words, their intent at that point is to say, is the campaign ready? Is it really ready to do what it's supposed to do? Then during the implementation, think about that 4-day period. We have our ongoing, what is called the in-process monitoring, which would mean colleagues are out in the field, again, independent monitors, not a part of the program, who are out there watching to see how things are going on. Are people where they said they were going to be? Did the vaccinators show up at the household or not? Those are the kinds of things they would be observing. They'd also be looking, are they seeing finger markings? Are they not seeing finger markings? Are they seeing parents at home or not at home? They're with staff who may be implementing the program, and they're there to see how it's going. From day 5 onward, you have your post-campaign, and there it's really trying to assess objectively the performance. They may know what happened before it started. They've been looking at what has happened during the process and now the after. And during this period, there's 2 parts to this. On the one hand, for the post-campaign, which that may involve sometimes staff members getting involved, it's less, it's less intensive than the other LQAS, which I'll talk about in a minute. But what it would mean is that you would have independent observers who would be making house visits, like the one we saw with the lady in the tent and her 6 children, looking at what's going on, looking for the markings, discussing with her to get some sense of what she may have seen going on. That's one type when we go to the home. The other type, of course, is what is called the out-of-house, or those kind of observations and visits in markets and streets, wherever they can find people in the community to observe, to talk with them, to see what they have to say. Again, the idea is to make some assessment of how the program was implemented now that it's over. What were some potential problems that may have occurred that they may have picked them up in the implementation phase, but now they're really trying to get a better sense of what it looks like at this particular point in time. And on the very last column, we have what is called the lot quality assessment, survey, which is a far more statistical process, whereas the other one may be a bit more qualitative and function in the in-house and market, people working with checklists. With the lot quality assessment survey, it has set up with a whole structure of certain kinds of, what do I want to call it, sampling that's used for them to really look at what has happened around certain behaviors as well as certain activities that they were expecting to see. If you've looked at your communication global guide, you will see more information around all these particular monitoring points and different indicators. As you will see, I have not talked about indicators specifically. You'll find those in the global guide. But you should also keep in mind that when we're talking about indicators, it's going to be a discussion that you have at country level as well. And again, I would make the emphasis and put a lot of weight on the discussions that have to happen at country level to be very clear on the priority of the priorities, to particularly get at the behavioral side of this as well as the process side of the polio campaign that is being undertaken. So we'll stop here because I think we may have some questions, and I know a number of you have a lot of experience doing this already. But the point I'd like you to keep in mind that when we talk about C4D monitoring in the polio campaign, think about implementation monitoring, put more emphasis on behavioral monitoring. That's within the staff, the people implementing the program itself. And don't forget that we also now take into account independent monitoring, which has now been expanded to include issues and questions around the behaviors that would interest us. So I will stop here with the 3 types of monitoring and open the floor for questions or comments.
Thank you so much, Irma, for that presentation and for explaining so much to us about the benefits of appropriate monitoring and evaluation. We have our first question from Jennifer. She asks, regarding independent monitoring, what are some of the possible conflicts that might occur between staff and independent monitors because of their different allegiances or interests?
Well, let me say, it's not so much of this. It's a great question. I think the way to think about the independent monitors are that they have come to help the program. Ideally, if you've been doing your implementation monitoring and your behavioral monitoring, what your independent monitors find shouldn't be a surprise to you. You would have been trying to do your own behavioral monitoring and implementation monitoring, as I said earlier, because you want to make mid-course corrections. If you see something's not working, that's your opportunity, because you're tracking on it, to say, we can make this shift. We can try to make this, solve this particular problem. So think of the independent monitors are people who aren't involved. They're supposed to be of a more neutral nature to try to help the program, help the staff look at gaps in areas that they may have missed. Could conflict occur? Sure it can. But again, I think that's going to be then a question of the kinds of interactions you have with the team in place and the monitors when they first come, and how important then it is for that briefing to take place.
Seems that we have a follow-up question here from Manoj, who comments, issues could get escalated to headquarters or above that. That's the question.
Well, I think at this level, if you're talking in the country, before we get to headquarters, more than likely the discussion would involve your regional offices with you to try to sort out if, in fact, you feel that something has not been picked up, then that's the time to involve your regional office. But again, I would put the emphasis on the fact those kind of issues tend to arise when you haven't done your own monitoring. So where we want to put the emphasis is how important that you as program do monitoring, not just wait for independent monitors to come in.
Thank you very much, Irma. It's great. We have many more questions coming in. For behavioral, back up here, sorry. From Glenn, are all monitoring findings transparent, or is there the use of confident reporting if findings are sensitive?
Glenn, it's the combination. There's a combination. The idea behind the reporting that is done by the independent monitors is that it's supposed to be transparent and shared with everyone. Of course, as you know, in real life practice, people oftentimes do their confidential reports, especially when there are sensitive issues, because it becomes a question of how to present the information. Not that one's trying to hide the information, but oftentimes how it's stated and when it's stated is an issue that needs further discussion.
Thank you, Irma. Another question is, for behavior monitoring by using photo snapshot, I'm not sure if it's referring to the one in your presentation, how can we take into consideration of ethical issues?
Well, one of the things, if you're using photos, of course, what you would want to do is the people that you're taking the photo of, you alert them that you like to do it and you get their permission to do it. Explaining that you like to, what you're trying to, not necessarily get into all the dirty details, but you're trying to get information about the program and so forth. As you notice in this particular picture, you really don't see the mother, so she's not as identifiable. Children are much smaller, and of course they change over time, so you may not know that. But you would have that upfront negotiation. It isn't coming in, sneaking, and taking a photo. Where you have an observation checklist, you may just have specific questions that you're asking your observers when they go out to a particular area to know what they're seeing. If that's an issue, then I can imagine, especially in situations where you have issues of security, I would not recommend taking photos. You might just have observations.
Great, thank you. Another question. Monitoring and evaluation are often looking after numbers or percentages as we are arguing doing interventions based on evidence. Are only numbers and percentages seen as data, or can we also take into account facts, form reports, and quotes from meetings as data in the area of C4D?
Yes, to your question. But again, when you're taking data from reports and so forth, again, you're putting it together to try to look for patterns and trends. If it's just a summary of what somebody said, that's not good enough. So when we're talking about using qualitative data, we've got to put it in some kind of conceptual framework that we're trying to use when we're trying to explain it to other colleagues. So whether you're using a theoretical or conceptual framework to organize the information, but you need to do something more than just a summary of these are all the things that different people said.
Excellent, thank you. We have another question from Yasmin. She asks, what is UNICEF's role in the training of independent monitors? We are not involved in all countries, and the results are sometimes not recognized by our country staff. How can we be involved in the C4D component of IM training more systematically?
I think that's a question, because when you talk about the IM, that's the Global Polio Eradication Initiative partners that oversee that particular function. I think what you have happening at the moment is UNICEF is in discussions with that particular group and with WHO around independent monitoring. We've seen an increase in people who, even if they're not from the C4D world, that as they sit and they work on these IM teams now, that there's information provided to them so they can go out and observe and see if there's certain kinds of things happening on the behavioral front. Your question is a good one, because it means as UNICEF, we have to put together those behavioral observation checklists so that anybody, you don't have to be C4D, but you have a very strong checklist, anybody could use to go out and observe. They see it or they don't see it. That's what it's trying to do.
Another follow-up question to that is from Martin, who asks, do the independent monitors develop their own monitoring framework?
The independent monitors have a set of global guidelines in it that allow them to, with specific things and indicators they're supposed to be looking at. This is where, in the earlier comment I was making, UNICEF can have a role in making sure that there are indicators or observation points from the C4D side. So the monitors have global guidelines, but it doesn't prevent them from adding something to their particular review or taking something out.
Fantastic. Thank you so much, Irma. On the discussion of plausible alternatives, which Irma cautioned us against, we have questions from Jennifer. The first part is, how are some of the ways you could preempt plausible alternatives and ensure that these are not used as excuses for not meeting goals? And can you provide an example from your own experience how plausible alternatives affected your own experience in executing or evaluating a project?
First of all, I think the point with plausible alternatives is, first of all, when I say collecting and being aware of what's going around you, that means you have really documented it. It isn't just you just refer to something else that was going on. You really do understand. So if I was implementing a polio vaccination campaign, for example, and we're talking to parents, we're going in, they're trying to get them vaccinated, and say WHO is pushing a malaria campaign at the same time, okay? Or somebody's doing some work around maternal health, and they're talking to mothers and getting them going. I may see energy and mothers willing to do things, not just because I did my polio part, but because somebody else is talking to them around something that's related to what I'm doing, that's also contributing. That's what I mean when I say plausible alternatives. It doesn't mean you don't explain what didn't work. You also use it to explain what did work. So, yes, you've done some work, but you want to know, was anybody else doing something besides yourself in that same community, talking to those individuals at the same time? It could be FAO having a discussion around agriculture. So it doesn't even have to be about health. It's the fact that these communities, these families are being talked and addressed by more than one agency simultaneously around different kinds of things that are seen as priority. And that might influence some of their own decision making. I would want to know that. I'm not making excuses, but what I would do in my reports, I've documented while we were running the polio campaign, the following things were occurring elsewhere.
Do you have a personal experience to share from this?
Well, that's what I was talking about in the polio campaign, where I was working with one, and in that particular case, there was some work going on with UNFPA around family planning. At the same time, we were talking to people around polio, so they were talking to mothers in the clinics around other issues, and at the same time, we're talking about a polio campaign. What we have to remember are these families are the same people. So if more than one agency, and let's not even talk about what the government or NGOs are talking about, they're listening to all of us at the same time and they're making some decisions. I'm going to follow you, I'm not going to follow you, that's confusing to me, this one told me to do that. So when I say in all plausible alternatives, it's just trying to say, is there anything else out there that may have had an impact, either positive or negative, on what I'm seeing?
Thank you very much, Irma. I think there's probably a lot of examples of that right now in Nigeria when you have a humanitarian crisis.
Exactly.
And a lot of partners working on different goals, but obviously the same end goal. So we have another question. We have many questions, so thank you so much for all of them. We're keeping Irma busy here. The first one is from Jamima. How to effectively structure the work of IM over an outbreak as compared to their work during a campaign, which would be 5 days or so?
That's a really good question, and I think it's a challenge we're all struggling with. Again, I think what it means is when you talk about that team coming in, that briefing in the very beginning is critical. And being very clear, given that they're there for a short period of time, because you don't want them to be another burden that the staff is trying to juggle as they're trying to get the work done. But it means being very clear about roles. And sometimes if you're in the middle of the campaign, you may not be able to do all the monitoring things I'm talking about at the level you want, but you should use that time to say, these are the things we would want you to pay attention to. And I think that's where sometimes UNICEF offices haven't done enough, to say, these are things we have a concern about. They're independent. Would you please, when you're out there, look for this as well? That gives you some buy-in to what they're trying to do and helps them get to your perspective of what you may be experiencing. So think of the independent monitors, again, as people who can help you do it better.
Excellent. Thank you so much. Another question from Martin. Activities should be data-driven and focused on high areas of population, I think villages. Unfortunately, IM data are not always available for all localities. What is your advice for internal monitoring by districts?
I think that's a great question, Martin. I think it becomes really important when I talked about the observation checklist, again, being very clear on what are the priority behaviors and behavioral components that are determinants that you want to monitor. That means you put a structured instrument together that you could share with any staff member so they're helping you collect that data. It's not relying upon the independent monitors, but you have to have that structured instrument that people can use as a guide. And I'm not talking about a 20-page instrument. I'm talking about a one-pager that people could use because you focused it on what you consider to be the most critical behavioral determinants that you want to track on as proxy for the larger behavior.
Jamima shared his experience here that working with independent monitors that have been drawn from the Ministry of Health, how independent can these results be?
Well, I think, remember, when you have a team, and I know that Narcisse is on this discussion and he can give his experience. I think when you have independent monitors that come from the government, it's important that the other monitors are coming from somewhere else. If all your monitors are coming from the government, you may have a problem for sure.
And as Narcisse mentions just below here, from his experience, the challenge that countries face is also to have available time and resources for timely C4D monitoring. They spend so much time assisting counterparts to plan the SIAs and then to implement them that in the end they rely on the so-called supervision and independent monitoring to provide sound data.
Right. And thank you, Narcisse. That's true. And that's why in the very beginning of planning for your program, you would want to identify those behavioral determinants up front. It doesn't have to take as much time to do that if you've done it back in the planning part of this. And we haven't discussed it here, but that gets at issues of pre-positioning, thinking ahead of a particular campaign. What data already? I would assume most of you would know if you're involved in polio program. What are the particular behaviors? That's clear. But what are the particular behavioral determinants you are considering the most critical? Once you identify that, then you just give people some sense of what to look for. What are you expecting them when they go out to do on your checklist that they can give you, and that once that information comes back, somebody's inputting it so it can be analyzed.
Thank you so much, Irma. And just a quick, a colleague of ours who wasn't able to join throughout the whole thing, a quick definition of plausible alternatives.
Plausible alternatives are other explanations from what you may find. You've made an intervention, and you think there's a cause and effect. Because you did this particular intervention, the result is due to you. A plausible alternative is that result could be due to somebody else's intervention.
Very good, very succinct. We have a bit of a comment here from Chaudhary. Is it pronounced that?
Yeah, Chaudhary.
If I did, I'm very sorry. Apologies. IM training led by WHO, data collected by IM monitors, sometimes doesn't capture mobilization response as accurately as it should. Like monitors capture first response but do not capture the second one, like messages heard from radios and leaving in mosque announcements.
But that, I think, is a good point. And again, that's where I think a project team can have a discussion on what are going to be the indicators that are in that particular checklist they're working from. As I told you, there's a global guide. But if you find there's some other things going on, this is an opportunity to have this discussion with the monitors of things that you think they also should look at. Because when I look at their global guidelines, they're very generic. So it is possible that people just have a generic and they're just using the generic template. But if there's other things that are important, it's really, I couldn't emphasize enough the importance of the country team having that discussion with the monitors before they start.
Sodarine asks here why UNICEF staff are not involved in independent monitoring to be sure that the quality of the data, especially for communications.
Well, you wouldn't, that's a very great question. That the idea behind independent monitoring is that independent monitors have no vested interest one way or the other on the results. All they're interested in is knowing what is the result. The perception would be, if UNICEF staff was trying to do independent monitoring, you're asking staff to evaluate their own work. So the perception is it's not neutral.
Very good. We have from Tommy a comment. I'm just back from the DRC supporting Communication for Development in a Yellow Fever campaign through WHO organized independent monitoring. However, after numerous requests, we never saw the data they collected. There was no collaboration and no opportunity to include C4D in the monitoring. So just to say, often IM is there, but we have no involvement. I experienced the same challenges in Nigeria with polio.
And I think, Tommy, that's a time when there's a discussion that needs to be held with headquarters. And with the polio unit, if it's your polio you're dealing with, or if you were dealing with the yellow fever colleagues, that's the discussion now of agency to agency at that higher level, saying why isn't the data coming out? What is the information? What is going on? Because now you're into the internal politics.
I have another question here from Rand Paul, asking, when you talk about M&E and C4D, qualitative data is more useful than quantitative. What is your opinion?
I think they're both important. They do different things. So yes, you can have some information if you're talking about monitoring where you're collecting qualitative, but more than likely you're using your qualitative data when you're trying to do more of the research and the rapid assessments. Remember, monitoring in and of itself is tracking. What you're trying to do is track on something. You're trying to develop and see if there's a pattern, is there a trend to it. So yes, there's some qualitative information you could try to collect, but if you're using, the observation checklist is qualitative.
I think this is I'm not sure, question or comment from Mary asking, IAM does program monitoring, which is more WHO responsibility, whereas C4D monitoring is UNICEF's.
Yes, but I think the thing is, the big push has been opening up IM so that it also looks at some of the C4D related activities. If you look at their activity list that they're looking at, if you just look at the implementation side of things, they've got questions related about social mobilization there. They have things on there where they're looking at that, it didn't happen, or it didn't happen well, or people didn't really do this. I think the key is that UNICEF will want to make sure that any IM team has some questions on there. It doesn't mean they have to have a C4D specialist on the team. It means they have to have someone on the team, or all the team members are looking at this area, and you've given them some strong indicators that they should be looking for that would represent, again, what you consider to be the priority areas to be addressed. If UNICEF hasn't done that, then we haven't done our job, because that's where your technical input really becomes important, that a team has that.
As well, if I understand correctly, with IM data, it helps us to gauge the gaps that we
right,
have.
Definitely. Right.
So that's where data really comes back to feeding into what's the plans, or when we re-engage with our operations plan and response plan. That way we know where we can focus more. We have a comment from Martin. Consideration of the plausible alternatives allows for accurate attribution of results.
Exactly.
So I think that was a really well understood and a very good point, the plausible alternatives. From Jennifer, she's just making a comment that we do have the webinar recording, and it will, of course, as always, be shared with everybody. So if you missed parts of it and the presentation as well, we'll share. So that's a good resource to have. From Savita, when implementation and behavior monitoring show repeatedly missed children, we are likely to need qualitative data to dig into the determinants of qualitative data. What is your practical advice for how this qualitative data can be effectively collected and combined into the larger monitoring framework managed by WHO?
Thanks, Savita. That's a nice, easy question to answer. Well, first of all, I think if we're talking about qualitative data, then we're talking about some type of rapid assessment that can be anthropological in nature. It can have even some quantitative components of it, but primarily we're looking at the anthropological, the ethnographic dimension of that. I think it's the timing of the collection, and it's the pulling together of the information that would be at the point in time, I think, when we're talking about monitoring, before your independent monitors get there, but as part of the whole planning, programming framework. And I think where we miss things sometimes is we don't incorporate it in our micro-planning, which is the major instrument people are going to be using in polio. So it's looking at where can you make that input when you're in the planning process to get ready for the next campaign or the next initiative on there. So it's collecting it, but again, use a rapid assessment, and then trying to look at what's the most strategic time to make that intervention. Oftentimes it comes after the fact and things are done. So you want to collect the data, but build it in early on before you do the next one.
Very good answer. Thank you so much, Irma. From Mahmoud, he asks, how do you compare IM and LQAS data?
How do you compare it? They're both collecting information around some of the same indicators. The difference is the sampling mechanism. LQAS is a statistical approach, and there's a certain way they sample the population. Whereas when you're just talking about the general program monitoring part of it, people are going out finding whoever they can find and talking to them. When you're talking about LQAS, it's much more systematic selection of who's going to be addressed. They may look at some of the same issues, but the way they're pulling the data together is what's influencing how it's going to be used. So you want to do both.
I think too that because they have different approaches, then it helps you to see if there's any errors in the data as well. So it's a good way of...
It's a comparative to the other kind of monitoring that independent monitors will have done. Because the LQAS uses a bit of cluster sampling and other statistical methods to get at it. Whereas when you're doing the more generic independent monitoring, you're not necessarily concerned with the sampling of it so much.
And just a comment here before I move to Frederique's comment from Manoj, just about what Savita had asked in terms of qualitative data. He mentioned, if the qualitative data provides you insights for an issue like resistance, the same resistance could remain one of the indicators for the WHO monitoring framework.
Definitely. Definitely.
And from Frederique, we have, are we aware of the IM report issued at the end of a polio round, giving more details on data gathered and presented in the Excel sheet? This report, under the control of the WHO, gives more information and comments that could be very helpful if there is another round to be done. And it's very informative.
Mm-hmm. Yes. Yes, yeah.
Do we have any other questions before wrapping up? We were almost at the hour, so if there's one or two pressing questions, please write them now. Otherwise, we will finish up, and if Irma has any summary she would like to provide.
Well, what I would say is there are a number of people that, as I look at the names on the list, that have a lot of experience working in polio campaigns, working in others. And I think it would be great if there was an ongoing discussion around monitoring for C4D. I think it's a big issue not only in polio, but across the organization in UNICEF. And I think there's so many possibilities, and it's more a discussion of, again, prioritizing. And I don't think there's enough done of what are the key indicators in my mind, conceptually, either from research, from the evidence, from experience, from theory, that helps me figure out what are the things the most important that I should track on. And I will insist that it's really important to remember you're not trying to track on everything. You'll kill yourselves. So you have to be clear what are the key things and why they are key.
And would you suggest any good reading material on M&E or other tools, Irma?
I think we will put that in the recording. We can give you some materials. Again, I remind you of the global communication guide. Has some information on that. There are a number of instruments that UNICEF has put together recently that would be useful, so I'll go back and just highlight those as a part of that. But I think the other thing to keep in mind is the field and monitoring and evaluation for C4D work is evolving. So it's not just one time, it's looking at what are other places where you can get this kind of information as well.
Thank you so much, Irma. With that, we're going to say goodbye, and thank you so much for your participation. This was a very fruitful discussion and a webinar with the most questions we've received to date. When I share the recording with you, I will make sure to share the tools that Irma has mentioned. And if you have any follow-up questions, please do not hesitate to write me, Alex McFedrin. I'm the one that sent the invite, so you can email me there, and we'll be sure to answer any other questions. Thank you again for joining us, and have a good morning, a good afternoon, and a good evening wherever you are. And best of luck in your monitoring and evaluation.
Have fun.